Let's talk about minerals, in which let's talk about zinc. What is a zinc? Zinc is an integral component of many metalloenzymes in the body. It is involved in the synthesis and stabilization of proteins, DNA, and RNA, and it plays a structural role in ribosomes and membranes. Zinc is necessary for the binding of steroid hormone receptors and several other transcription factors to DNA. Zinc is absolutely required for normal spermatogenesis, fetal growth, and embryonic development. Absorption of the zinc. How it occurs. The absorption of zinc from the diet is inhibited by dietary phytate, fiber, oxalate, iron, copper, as well as by certain drugs including penicillamine, sodium valproate, and ethambutol. Meat, shellfish, nuts, and legumes are good sources of bioavailable zinc, whereas the zinc in grains and legumes is less available for absorption. What happens in the deficiency of zinc? Mild zinc deficiency has been described in many diseases, including diabetes mellitus, HIV or AIDS, cirrhosis, alcoholism, inflammatory bowel disease, malabsorption syndromes, and sickle cell disease. In these diseases, mild chronic zinc deficiency can cause stunted growth in children, decreased taste sensation, that is hypoglycemia, and impaired human functions. And impaired immune function. Severe chronic zinc deficiency has been described as a cause of hypogonadism and dwarfism in several Middle Eastern countries. In these children, the hypopigmented hair is also part of the syndrome. Acrodermatitis enteropathica is a rare autosomal recessive disorder characterized by abnormalities in zinc absorption. Note that word acrodermatitis enteropathica is a autosomal recessive disorder in which there is abnormality in zinc absorption. Clinical manifestations include diarrhea, alopecia, muscle wasting, means muscle loss is there, depression, irritability, and a rash involving the extremities, face, and perineum. The rash is characterized by vesicular and pustular crusting with scaling and erythema. Occasional patients with Wilson's disease have developed zinc deficiency as a consequence of penicillamine therapy. As we can see, there is a mild zinc deficiency in many diseases. Zinc deficiency is prevalent in many developing countries and usually coexist with other micronutrient deficiencies, especially iron deficiency. Note: The zinc deficiency is prevalent in many developing countries and it usually coexists with other micronutrient deficiencies, especially iron deficiency. Zinc 20 mg per day until recovery may be an effective adjunctive therapeutic strategy for diarrheal disease and pneumonia in children greater than or equal to 6 months of age. Right? The diagnosis of zinc deficiency is usually based on a serum zinc level less than 12 micromolar moles per liter, that is less than 70 microgram per dl, indicates zinc deficiency. Pregnancy and birth control pills may cause a slight depression in serum zinc levels, and hypoalbuminemia from any cause can result in hypozincemia in acute stress situations, that is illness, but also post exercise recovery. Zinc may be redistributed from the serum into tissues. Zinc deficiency may be treated with 60 mg of elemental zinc taken by mouth twice a day. Right? Zinc gluconate lozenges, that is 30 mg of elemental zinc every 2 hours while awake, have been reported to reduce the duration and symptoms of common cold in adults, but study results are conflicting. Right? What happens with the toxicity of the zinc? Toxicity means simply overdosage of the zinc. Acute zinc toxicity after oral ingestion causes nausea, vomiting, and fever. Zinc fumes from welding may also be toxic and cause fever, respiratory distress, excessive salivation, sweating, and headache. Chronic large doses of zinc may depress immune function, as already mentioned, and causes hypochromic anemia as a result of copper deficiency. Intranasal zinc preparations should be avoided because they may lead to irreversible damage of the nasal mucosa and anosmia. Right?